In my nurse heart, in my mama heart, I knew that this birth center was special and greatly needed.
Lindsay Micka, a Bellarmine University grad, was supposed to start her orientation this Monday, set to be a nurse in the labor and delivery unit for UofL Health's brand new birthing center at Mary and Elizabeth Hospital.
I got a phone call from the director to notify me that the position was no longer available.
Instead, the center's opening is now indefinitely delayed, and Micka says her new job is gone.
I was shocked and devastated.
If they aren't cuts, how would you categorize them?
Well, they're reforms.
In our studios, I sat down one-on-one with Republican Kentucky Congressman Brett Guthrie of Bowling Green, one of the architects behind the cutbacks to the federal Medicaid program, established by Donald Trump's big, beautiful bill.
We're just talking about going back to 2021 numbers and still growing your Medicaid.
Reducing some of the expansions.
Well, we're still pay 90%. What we're asking the state is to pay their fair share. The state signed up for it.
UofL Health tells us the most severe cuts don't go into effect until 2028, but they're planning now and putting projects like the birthing place on hold. I asked Guthrie about it.
If we just keep expanding Medicaid because hospitals want to raise their rates, then we're never going to get to the end of it. And so we said, you need to manage your budgets. And so they need to talk to their state legislators, talk to the governor.
Kentucky Governor Andy Beshear, a Democrat, has said rural hospitals will close as a result of reductions in federal Medicaid funding.
And we're not doing that. We're not for that. We don't support it. It's not part of my platform.
Is Medicare and Social Security next in your mind?
Well, so Medicare and Social Security was off the table. That's what we focused on, Medicaid. But in terms of the benefits that people receive, that's off the table. President Trump's made that clear. I've made it clear. And so, no, people will not be looking at any cuts to their Medicare benefits.
Back at the hospital, Lindsay Micka is already pointing to the midterm election.
This is what's on the ballot come November 2026. When voters go to the polls, they need to remember just what's at stake for our community.
And Doug and Connie, we actually got a statement from UofL Health just a few minutes ago. They basically said this press conference that was held across the street from Mary and Elizabeth Hospital this morning, it was actually a campaign event mixed in. They said we did not authorize that press conference. We played no part in it. And they also said, listen, in their words, this decision was a financial one for them to make sure that they didn't have to cut back on other programs. They do say other women's health programs are going to be expanded in the future, just not this specific.
You're saying it's a campaign event for Stevenson?
Sherilyn Stevenson, she's running for Congress. She's in the Lexington area. And they, of course, are big on this Medicaid issue. So they actually brought the employee you saw there forward.
All right.
The street.
Okay. Thank you very much, Isaiah.